The South African government adopted the ABC campaign as its main prevention strategy in 2003. The ABC approach was developed by the US Agency for International Development, USAID, based on Uganda's success in reducing HIV prevalence.
Umsebenzi engiwenzayo ke involve izinto eziningi la ku life orientation sifundisa futhi nange AIDS siyafundisa ngayo ama STIs ama sexually transmitted infections abantwana fanele bazi ukuthi I risk yokulala iletha ini empilweni zabo. Ritibela jwang taba ya 80 re ka etsa jwang na gore 80 iskebe ya fitla ko rona
o ka tibela ka o tshepahala motho wa ha o ratanang le yena
so ungene kubani ungene ku bine B stands for be faithful, C stands for manje ke indaba ke ye ABC yona iyasebenza kodwa ke uC simsebenzisa mase sibona ukuthi sesi exhauste wonke nankamanye amacebo afanele ukuthi asetshenziswe ukuvimbela leli gciwane ebantwaneni.
I think in this modern age, one would ask, given the availability of measures for protection against pregnancy, why are young people failing to use these? The clinics are accessible, there are more and more clinics. Maybe we need to think of youth clinics, youth centers. So we need to be perhaps more responsive to the problems we're identifying. And our concern is we always trot out just one solution, ABC, condomize. You know, instead of saying to young people, do you know that actually if you engage in sexual activity, you can take these steps and you do not have to become pregnant. You can take these steps and you will protect yourself from becoming HIV positive. Use a condom. I mean, we say it, but people want us to hand condoms to children, and I'm not sure what message they would be asking us to be sending with respect to that.
Ntwena ya ABC ke a isebetse. A isebetse hobane re fumana hore batjha ba bangata ke bona ba tholang AIDS. Ke bona ba imang.
Okay, now hore ntwe e tla isebetse ke nahana hore re tlameha hore re practice. Ho tle hore re practice, I mean hore we must practice it as in physically hore e tle hore e be teng, yabo.
How taba ya abstain right ba ke?
Yeah.
O tshepahale. Taba condomize ke yona ke sa thusiseng.
At least we have to be protected in a way. It's another term of saying prevention. O tlisise ke ntwe e ke buang.
Wena o ntse hore taba ya hore dikgohlopo di fane sekolong e lokile.
Prevention is better than cure, Musa, okay? It's better to protect these kids. Let them be on the safe side instead of exposing them to HIV/AIDS. Because if condoms are not distributed at schools, these kids are definitely going to get infected. We can't stop them. The better thing is that we protect them by giving them condoms. We're not promoting it, but we're playing it safely.
And the young people must exercise the responsibility, must be the ones who ensure they protect themselves.
Ke lutla ka felela buo lentsha di feelings tsa lona. Empa ke a botsa ke bo mang ba lona ba abstainang? How many are you? Ke le bone ka felela ba abstainang. Ke bo mang ba tshepahalang? A tshwere ke a tshepahala 100%. Ke bo mang?
Big fight for.
Ke ba kae ba sebedisang kgohlopo o ba sebedisa kgohlopo raincoat all that ke ba mang ba sebedisang Tole kutlile ke bona hona motho a sebedisang kgohlopo ka mo ba teng ba robalanang ba having sex ke bon ba lona moa ba sebedise dikgohlopo, you know, ba robalana. Ke ntho ne ke itjho ke re APC method a e sebetse. Ha be ne e sebetsa, nkebe le sebedisa kgohlopo, mme nkebe le tswa dikotsing tse teng. Simple.
We need to ask ourselves what more beyond ABC. How do we strengthen the impact of that message so that young people are so alert to the issue of prevention that in fact they guard their status as a status of negative HIV.
The first microbicides conference on African soil was held in Cape Town in April 2006. Microbicides are substances that can be applied to the vagina or rectum to prevent the sexual transmission of HIV and other STDs. At present, an effective microbicide is not available. The conference also discussed other interventions such as ABC, post-exposure prophylaxis, circumcision, and our response to gender violence.
Despite the huge investment we have made on HIV prevention, little has changed. The existing methods to prevent HIV infection are failing many women. Asking women to simply abstain, be faithful, or use condoms is not practical. For too long, we have paid lip service to gender equality and have shown modest results. Our efforts have been insufficient and inefficient, and we have shown a lack of urgency in creating a more equal society.
The current quality of gender relations give women little power to negotiate protection against this disease.
We will recommend that every person in this country, young and old, but especially young people, should test for HIV. All of us should know, are we positive or are we negative?
From a biological perspective, there is now more evidence for this intervention than probably any other biological intervention for making it better. Circumcision would decrease the rate of HIV by 70% in over an 18-month period. That's better than any of the most ambitious projections for what the vaccine is going to do.
We can no longer remain silent when our sisters face sexual violence, rape, and female genital mutilation. We can no longer stand for discriminatory laws that deem women as minors. We must hold our governments and institutions accountable for the decisions they make or they fail to make.